Hey guys, this is a session on non-benzodiazepine hypnotics. So this is a sub-classification of the hypnotics and sedatives. So example includes zolpidem, zopiclone, xalapon, esopiclone, and itizolam. Remember at least three examples. They'll usually ask example from this part. It mainly includes zolpidem, zopiclone, and xalapon. Remember the three Z's at least: zolpidem, zolpiclone, and xalapon. These are the one which are usually less potential for abuse compared to the benzodiazepines. They have less anti-anxiety effect, they have less anti-convulsive and less muscle reactant effects compared than that of the benzodiazepines, and also they have the less effect on REM, that is rapid eye movement sleep, compared to the benzodiazepines. The first drug is zolpidem. Remember at least 3 to 4 points about the each drugs and their mechanism of action in general. Zolpidem mainly produces the hypnotic effect. It decreases the sleep latency, the sleep time period you require to fall asleep. It decreases that time. It increases the duration of sleep time in insomnia. It produces near normal sleep like benzodiazepines with the minimum alteration in the REM sleep, and causes minimal hangover effects and rebound insomnia. So it is like it will try to decrease your duration of sleep, it will decrease the hangover effects, and it will cause a near normal sleep after you take this zolpidem. But the main feedback of this drug is it has a lot of dependence and tolerance to this drug. Like if you once start to take this drug, after 3 to 4 days, you feel like taking it again and again, so that all your hypnotic effects will be reduced. It causes a lot of tolerance and drug dependence. As we have said, it lacks the three properties, that is anticonvulsant, it has the less anti-anxiety and muscle relaxant effect compared to the benzodiazepines. These tablets are usually given orally. Remember the route. So I'll write it here. The route is oral. Remember this. And it's metabolized in liver. It's metabolized mainly in the liver, and it's excreted in through urine. Remember these 3 points. The route is oral, it's metabolized in the liver, and it's usually excreted through urine. It has a shorter duration of action, and it's used for the short term treatment of insomnia. Like if you have a insomnia for a shorter period of time, like it's for some 1 days, 3 days, 4 days. So generally you can use this non-benzodiazepine hypnotics there. The actions of zolpidem are antagonized by flumazenil, as we have studied for all the benzodiazepines and non-benzodiazepine hypnotics. The usual antagonist is flumazenil, but even it has a lot of side effects like vomiting, headache, nausea, unconsciousness, confusion, and headache, etc. So, speaking about the actions, for all the sedatives and hypnotic drugs, the mechanism of action still remains the same. Just put the drug's name of that respective group. If you consider the non-benzodiazepine drugs, then add zolpidem, Z drugs, Z group drugs. Zolpidem, zolpiclone, xalapon, all these drugs, they'll bind to the GABA receptors present there, and it facilitates the GABA mediated neuronal inhibition, and therefore it causes the CNS depression. Next drug is zopiclone. It's a orally effective drug, and it's used for a shorter period of time for short treatment since it has a shorter duration of time. It produces near normal like sleep like benzodiazepines, but the side effects are always same, that is headache, drowsiness, nausea, GI disturbances, metallic state, etc. Xalapon. It's also useful in the shorter onset and shorter duration of action kind of sleep, and it is useful in the sleep onset insomnia. And the next one is esopiclone. It's usually used orally for short as well as long-term treatment of insomnia. Zopiclone and esopiclone. You can remember all these two drugs also. It's you have to just add es in the prefix. Next is itizolam. It's a benzodiazepine analog with the hypnotic, anti-convulsant, muscle relaxant, and anti-anxiety effects. It's usually used for short-term treatment of insomnia. Out of these drugs, the one which you can use for both short-term as well as longer duration of action is ezopiclone, whereas other rest you can use all the drugs. They have the same effect and same kind of adverse effect. They can be usually used through oral route, and it's metabolized in liver, and it's usually excreted through urine. It has a shorter duration of action, and therefore it's used for the shorter treatment. And the common side effects includes headache, confusion, nausea, vomiting, metallic taste, all these things. Remember the three drugs: zolpidem, zopiclone, xalapon. These three are enough. So that's it about the non-benzodiazepine classification. I hope you have understood the video. Please do comment, like, share, and subscribe. Thank you.